Doctor, what is hearing loss?
Deafness is a decreased ability or complete inability to hear. It may be partial or total and affect one or both ears. Approximately 40% of adults over age 65 have some degree of hearing loss.
Doctor, what causes hearing loss?
Hearing loss can occur for unknown reasons and at any age, including in infants. The cause can be a problem in the ear canal or middle ear that blocks sound. The inner ear or nerves that carry sound to the brain can also be damaged. Other causes are sudden loud noise or continued exposure to loud noise, viral or bacterial infection of the ear, certain drugs, and puncture of the eardrum. Most people older than 65 have some hearing loss. Risk factors are a family history of deafness and having a job or hobby with exposure to high noise levels, such as rock musicians or jackhammer operators.
Doctor, what are the symptoms of hearing loss?
Infants with hearing loss don't respond to sounds around them, especially startling sounds. In adults, symptoms include trouble telling the difference among sounds, such as being unable to follow a conversation if there's background noise, turning up the radio or television volume, ringing in the ears, dizziness, and ear pain.
Doctor, how is hearing loss diagnosed?
The doctor will examine the ears and test your hearing. The test for checking your hearing is called audiometry, and this uses a device that makes tones of different loudness. Other tests involve using a tuning fork, checking the ability to hear differences between words that sound similar, and measuring how loudly words have to be spoken.
Doctor, how is hearing loss treated?
Treatment depends on the cause. Sometimes, simple earwax removal, or eardrum puncture repair may solve the problem. The doctor will prescribe medicine for an infection. Drugs or exposure to loud noise causing hearing loss should be stopped. Surgery may sometimes restore hearing. For profound hearing loss, a cochlear implant can sometimes help. This implant, placed inside the ear, is a type of hearing aid that can make sounds louder. Many people learn to rely on hearing aids. Even if hearing loss is permanent, people can live normally. The important thing is not to become isolated. A local rehabilitation facility may teach sign language and lip reading. Speech therapy may be necessary.
Doctor, what are the do's and don'ts in managing hearing loss?
Do avoid long-term exposure to loud noise. If you cannot, wear ear protection, earplugs or earmuffs. Don't force anything, such as cotton-tipped swabs, in your ears. For more information, log on to www.healthlibrary.com.